these statistics coming out of the Guttmacher Institute that clearly shows this reality, this impact. So it looks like, just to kind of set this up, it looks like starting in 2020, after years of an actual decline in abortion numbers, we started seeing this uptick. Despite the overturning of Roe v. Wade, we are still seeing this increase. And specifically here in Virginia, it looks like data is showing at least a 60% increase from, I think they were comparing it to the first part of 2020 and then looking at the first half of 2023, 60% increase. Why is that happening? What's going on?
Yeah, I mean, I think we have to go back a little bit to right before 2020, and we need to understand what had happened in Virginia. So over a period of years, we had passed some really important incremental policies that would protect human life. So things like, are there going to be safety standards in abortion facilities? And why that's important is because it's unfortunate, but it tends to be the case of the abortion industry. Rather than spending money to make sure women are safe, even if unborn children aren't, they tend to shut down. And so we had closures of clinics as a result of that. We had a bill that was a window to the womb bill that just simply says a woman has a right to her own medical diagnostic test, which is to see her ultrasound. So if she's going to think about an abortion, let's at least let her see what, so she takes the decision with all of its information. So we had these really important things. And those laws, from the point at which we had all those incremental laws put in, over the course of 5 years, we had a 40% abortion reduction. So really big deal. The whole country was going down slightly. Virginia was really dropping.
How many lives do you estimate that is?
Yeah, so we looked at what the difference is, and we believe it saved over 16,000 lives during that time period. So and we talk about this because it's important people understand, even if you can't get the most pro-life law, and if you're getting something, you're saving lives each year, right? So that was a big deal.
And also that we shouldn't deal with this because it's politics. No, these laws resulted in 16,000
lives saved.
It's about lives.
It's a big deal. So then, of course, get to, right before 2020, so that session, we then have a liberal House, liberal Senate, and the governor we all love who said, let's just keep the baby comfortable after it's born and then make a decision, right? We all remember that moment with Governor Northam. So during that era, they wiped away all of those incremental laws. So with one bill, all of that comes off of our code. And so the abortion industry can run rampant and they can do whatever they want, and women don't get all the information. Mm-hmm. And that took effect July 1, 2020. So it's really relevant to this data because we said at the time, look, we know that this has made a significant difference in the decline. If you take all that away, you're going to see an uptick. And unfortunately, we have. Now, there's even more factors in the uptick beyond that. But that was definitely the starting point because that's what changed at the point where we're starting to see these numbers bounce right back up.
Quite a dramatic increase. Yeah, thousands of more lives being lost. So.
And then, of course, you have the tourism abortion, which they're commenting on in lots of articles. A lot of articles make it look like this is all about tourism abortion, but some of our neighboring states only recently actually banned abortion to the degree that they have. Mm-hmm. And so the abortion tourism doesn't start in 2020, right? It's post-Dobbs. So but we don't, that's what's scary. We don't know how much that's going to compound an already difficult problem. And then, of course, we have to talk about chemical abortion and how that plays into all this.
Yeah, I was going to ask you how much, I wanted to hear, do you think that's the majority part of this increase, the chemical abortions?
It's hard to say. I would say this. The chemical abortion message that is being given by Planned Parenthood is just take a pill, it's a piece of cake. Don't worry about it. It's like take an Advil. Mm-hmm. That is how they're treating chemical abortion. That is so I think there are a number of women who don't have all the information, think this is the route to go. And now it's sort of, we have this era where it's been being given out basically with hardly even a doctor because of the Biden regulations. We've talked about that before. But I mean, basically they haven't even had to kind of go through the steps of what you would with a surgical abortion. And so, I think that's a big factor here.
I actually do think it is a large part of the increase because it makes it easy for women to divorce the emotion of that decision, that action, at least in their mind, divorce themselves from the reality that this is a human life in the womb because in your mind as a woman, you can take a pill. You can do it in the secrecy, the privacy of your home. You don't have to interact with other people about it. No one has to know. You don't even have to interact with a lot of, or if any, medical professionals. So it just becomes something you're doing unilaterally, and a pill feels pretty divorced from the reality of human life. But the reality is you're not divorced from it because, sadly, there is a real risk of complications. You are, even if there's not complications, you are going to feel some heartbreaking, the real outcomes of that, of a baby, a human life leaving your system. And when you're doing something like that, there are serious risks that are scary. And that's why this is frightening, that women just don't even know about these complications. Tell us about this news headline. It's heartbreaking. This young woman that really puts a human face to this.
Yeah, I mean, gosh, just recently there was a news story of a woman out of the state of Nevada. She was 24 years old, so her whole life ahead of her, essentially. And she's a young mom already. And her name is Aliona Dixon. Sorry if I got that wrong. But and basically, she was prescribed the 2-dose abortion, chemical abortion at a Planned Parenthood clinic. And according to the family attorney, she ends up, the cause of death is a septic abortion. It's from basically her body having an infection, reacting to the abortion, her not really being in medical care. And so she, unbelievably, I mean, it's just devastating because she leaves behind a 1-year-old child.
This happened in less than a week.
Yeah, it was a
They
week
lost her in
from
less than a week.
And her family basically said it happened so fast they had no idea. They didn't get to say goodbye. I mean, and that 1-year-old now doesn't have a mom. And I mean, this is just a reality that I don't think is ever talked about, as the abortion industry just keeps pushing this. And I think, a lot of folks know Abby Johnson's story. It's another example where she just talks about what it was really like to have a chemical abortion. In the movie Unplanned, you can, you literally, and even when there's not a complication like this, just the process is so much more than women are prepared for. And I just think that is just tragic. Like anything else this serious, a doctor needs to be involved, and they need to know that this is really what they're doing. I mean, your body isn't intended to take the life of your unborn child. That's not how God made us.
Yeah. Well, I'm just thinking, this is getting buried. These women's faces are getting buried in the news coverage. It's getting covered up. Even with the federal requirements, the complications, we do not have sufficient requirements right now, correct, to report complications like this.
Well, even more than that, the news story that just came about the woman who went to CVS and she was given the chemical abortion pill instead of a fertility drug.
Wow.
And it took literally, she's trying to get pregnant. They make a fault, they just make a mistake. But you just think about, how do mistakes happen? Well, when they're outside of a doctor oversight, I just sit there and think, we are taking a human life. This can't be done like an Advil. It can't be done even like a prescription over-the-counter pill. It's in another category.
Well, this 24-year-old who just lost her life in less than a week, had a 1-year-old baby. I do think about the leftist campaigns saying, say her name.
Yes.
And I think maybe because these just get shuffled,
the media does not want to talk about this because it messes up their narrative.
So I think maybe we need to have the same kind of dedication to these women that lost their lives. Maybe we need to start saying, say her name.
Yep.
Yeah.
Yep.
All right. Well, I'm going to shift gears. That's a sobering topic.